It is great to see everybody. I want to welcome you to today's Global Existential Challenges seminar series. My name is Deborah Yashar, and I'm a professor in the politics department and also in SPIA, and also the director of Pierce, which is obviously hosting this session. I want to thank everybody at Pierce who has helped make this happen, in particular Rachel Golden, who helped organize this, and also Carol, who's in the back, who's helped with all of the food and the like. Today is the fourth in a series of panels. For those who might be new to the room, let me just tell you what we're trying to do. During the course of the year, we are holding more or less monthly panels where we're inviting Princeton faculty to come together to talk to one another about these core issues. As you all know, we have lots of seminars, we invite in lots of speakers, but oftentimes we don't have the opportunity to talk to one another. And so the goal of this is to bring people together, oftentimes with extremely capacious themes that cannot be covered in one session alone, but at least to generate the conversation, knowing that more will come. Today, we're going to focus on gender, sexuality, and reproductive rights around the globe. That too is one of these themes where we obviously cannot cover it all in one session, but we hope that the conversations will continue afterwards. And I just want to say a few words before I turn it over to our speakers. This seminar is obviously to me a response to two things. One is that the Academy is doing incredibly interesting cutting-edge work on these themes, including our colleagues here, but it's also a response to recent events that have been happening around the globe, particularly in the past year, but not only in the past year. So we know that academically, and our colleagues will speak to much of this, there is a lot of interesting work that's happening in the social sciences in particular, although not only the social sciences, where folks are thinking about how gender and sexuality both inform and are informed by broad patterns of things that are happening at the macro level, but also in terms of microdynamics, raising really important questions theoretically about what is a right, what is justice, what is possible, amongst many other things. So we really look forward to hearing from our colleagues on that and other sets of issues. And of course, we know empirically that there have been diverging patterns of late, particularly around the globe. We know, and I will just reiterate what we all have read, we've seen ongoing restrictions around parts of the globe, particularly in the global south, but not only in the global south, about the ability to dress freely. I'm thinking here about recent dynamics in Iran, to receive equal pay. You could say that's everywhere. To embrace one's sexuality, both as identity and practice, to exercise reproductive rights, amongst many other issues where there have been ongoing restrictions. We've also seen dramatic constitutional and legal challenges, even reversals of rights that were once achieved, moving once in a liberal direction and now moving away. We need only look at what's happening in the United States around reproductive rights. I'm sure Betsy will speak to that about Roe v. Wade. And even now we have seen before the court a discussion yet again about LGBTQ rights as clients vis-a-vis the marketplace, amongst many other sets of issues. And of course, we've seen violence playing out in the streets against women, against the LGBT community, against providers of reproductive rights, amongst other issues. However, all is not despair, and this is one of the things I was really hoping that we could also talk about, because there have been movements in other directions. Of course, we've seen a rise in gender representation. We talked about this amongst some of us early in the morning through various measures that have required a certain representation, but also even in places that haven't, an increase in gendered representation. Increasingly, countries have signed on to the Violence Against Women's Act. Footnote, not necessarily implementing it, but at least signing it. We've seen changes in terms of marriage equality. And I'm sure you all saw this morning, I think it was around 11:30, the Congress just passed the Marriage Rights Act, and it will go to Biden's desk to sign. And there has been in Latin America a place that was oftentimes resistance to these changes, what's oftentimes referred to as the Green Wave, which is an effort to promote reproductive rights, in some cases decriminalizing, another making abortion rights legal. And here, Argentina, Mexico, and Colombia really stand out. Of course, the case of Ireland is itself a fascinating case outside of the Americas. So there are a lot of things that are in play. We're not going to answer all of these questions, but the goal here is to bring together some scholars who can get us to start to think about these issues in the context of the United States, in the context of India, I'll come back to this, in the global south, and at a transnational level. So we have three outstanding scholars, colleagues, friends who are going to help us to think about that. They have a diverse range of topics, diverse geographies, diverse methodologies that they're using. But interestingly, they're all thinking about these questions of gender and norms and practices, some focusing in addition on sexuality, others additionally focusing on reproductive rights. So let me get to the speakers and then turn it over to them. First up will be Betsy Armstrong. She's well known to all of you. She's an associate professor of sociology and public affairs here at the university, and also head of Butler College. I saw her wearing her jacket that was advertising this. Fantastic. And she's been involved in many centers and programs on campus, more than I could actually mention today. Her research has been primarily focused on the United States, located at the intersection of medicine, health policy, and culture, with a particular focus on gender. Again, many things I could highlight, but I just want to note here that she's explored the modern evolution of obstetric medicine and the development of ethical and evidence-based policies around maternity care and the notion of fetal personhood in that context. I also learned that in the context of the pandemic, she's been looking at pregnancy and birth, which is also fascinating. And here I really want to highlight one of her earlier books, Conceiving Risk, Bearing Responsibility, Fetal Alcohol Syndrome, and the Diagnosis of Moral Disorder. I need to say that Betsy is also a fantastic teacher and here on campus. And in the spring, she'll be teaching the sociology of human reproduction, which is a big class. There's a lot of interest. I want to just flag that for those of you who might be interested. Second, I want to welcome our colleague, Tanushree Goyal. Tanu is relatively recent to the Princeton community, so it's great to have you here on campus and also in this context. She's an assistant professor of politics and international affairs at the university, and prior to that was a postdoctoral scholar at the Harvard Academy for International and Area Studies, affectionately known as the Academy Scholars. At Harvard, and is affiliated as a non-resident visiting fellow with the Center for the Advanced Study of India at UPenn. Her research has largely focused not on the United States, but on the global South, with a focus on India in particular, and oftentimes putting that into comparative perspective with Brazil and Ghana. Her research interests lie at the intersection of comparative politics, gender and politics, and the political economy of development. And broadly defined, her work looks at gender disparities, particularly thinking about institutional strategies intended to reduce gender disparities in political opportunity, but also in terms of participation. She has a forthcoming book project that's entitled Representation from Below, the Grassroots Origins of Women's Political Power, where she looks at these questions, particularly in the context of party politics and democracy. And in the spring, she also will be teaching a course entitled Gender and Development that is based, I think, in two places. Is that right? Both in the politics department and SPIA. So there will be two opportunities, but these are small seminars. So that is a second course in the spring, which is great. And then finally, Kristopher Velasco, who is also new to this community. So again, welcome to Princeton. We just met this morning. It was lovely to meet you then, and I'm looking forward to your talk today. He's an assistant professor of sociology, and his research has been quite wide-ranging. It focuses on the intersection of global and transnational sociology, organizations, political sociology, culture, and sexuality. He has written many different pieces, but the following questions really drive his research agenda. And here I quote from your website: how do societies become more inclusive over time? And what is the role of organizations and institutions to facilitate social and cultural change? I should note that in the context of today's panel, he's particularly interested in transnational civil societies, organizations, and their ability to affect social change, both to institutionalize norms of cultural expectations and appropriateness. He too has a current book project entitled Caught in a Web: How Opposing Transnational Networks Undo LGBT plus rights, among many other publications, including on research methodology. And he's a quantitative and computational scholar alongside other things. All right, What is he teaching? Research methods and identities. Research methods, 1. And secondly, identities, race, class, gender, and sexuality, 2. And so we both have an incredible opportunity to hear from our colleagues today. For those of you who are taking classes in the spring, I hope you will also take advantage of the classes that are being taught then. Each of them will have 15 minutes. Each of them will be videoed. I should have said that at the start. It will be posted, and I want to give them a warm welcome.
Hello, Deborah, thank you for that very generous introduction. I'm really honored to be here today talking to a peers audience. As Deborah suggested, my own work is very focused on the US, particularly in the arena of reproductive justice and maternal and child health. But what I hope to do today is situate what's happening in the United States around reproductive rights, abortion in particular, in a more global kind of framework. And I want to highlight several paradoxes around abortion in my talk today. So I'm going to start with the paradox that abortion in the United States has the curious quality of being both omnipresent and invisible. Abortion is highly visible in the political sphere, but it's also often unspoken and unacknowledged at a personal level. Abortion as an experience and as a healthcare practice remains largely stigmatized in the United States. And there are many aspects about abortion that are sort of unspoken or unaccounted for in the kinds of political debates and contests that we see around abortion access. The second thing I want to note is that abortion is often framed as a conflict. And this conflict takes place at the micro level. Abortion is seen as a conflict between the pregnant person, the pregnant woman, and the fetus. At a meso level, abortion is a conflict between protesters on one side of the picket line at a clinic and women, their companions, and clinicians on the other. And at the macro level in the United States, we have a big conflict between so-called pro-life and pro-choice. And I'm going to just leave aside for right now what those terms actually mean. So let me give you a few facts about abortion globally and in the US. As I said, I'm going to try to toggle back and forth between what's happening in the US and what's happening globally. So globally, 25% of pregnancies end in induced abortion. In the United States, about 1 in 4 women of reproductive age will experience an abortion over their lifetimes. Abortion is one of the safest medical procedures if it's done following WHO guidance. Here's another paradox. Abortion is also a leading cause of maternal mortality worldwide. WHO estimates that 5 to 13% of all maternal deaths worldwide are due to unsafe abortion, but this can be as high as 30%, 1 in 3 maternal deaths in some countries. Abortion is widely recognized as a human right by many international and regional organizations, including the UN Human Rights Committee, the Inter-American Court of Human Rights, the European Commission on Human Rights, and the African Commission on Human and People's Rights. And within the United States, abortion is recognized as a right and as an essential aspect of healthcare by many medical organizations. Today, about 59% of the world's women live in countries that broadly allow abortion. That means at the same time that 4 in 10 women live in places where abortion is legally restricted. 90 million women live in countries that prohibit abortion altogether under every circumstance. These countries include the Republic of Congo, the Dominican Republic, Egypt, Iraq, and the Philippines. So let me give you a little snapshot of abortion in the United States today. About 1 in 5 pregnancies end in abortion in the US today. Most of these abortions take place in the first trimester. In fact, 2/3 of abortions in the United States today take place within 8 weeks of gestation. 92% take place within 13 weeks. Most women who have abortions in the United States today are already mothers. About half of them report using a contraceptive method at the time that they conceive the pregnancy. And about 75% of women who seek abortion care in the United States today are poor or low income. About 62% of women who seek abortion in the United States report a religious affiliation. 24% of them are Catholic women. So I want to give you a very condensed history of abortion regulation in the United States, and then again, turn the focus outward to the rest of the world. So women have always sought to control births in every society that we have evidence about this. In the early days of the colonies in the American Republic, women regularly practiced something called menstrual regulation, or bringing down the courses or restoring balance. This was a way of inducing a late period to come. It wasn't even necessarily recognized as interrupting a pregnancy or terminating a pregnancy. Indeed, pregnancy was not widely recognized until the point of quickening, or the woman's first perception of fetal movement in utero. This takes place around 16 weeks of gestation. Beginning in the last quarter of the 19th century in the United States, abortion began to be criminalized. This was largely at the impetus of the medical profession, the organized medical profession, that was seeking to consolidate professional control and crowd out other kinds of providers, midwives in particular. So in targeting midwives as a way to achieve professional dominance, physicians lobbied to make abortion criminal or illegal. By the mid-20th century in the United States, hospitals had in place abortion committees to evaluate women's need for abortion. So the criminalization of abortion was accompanied by a medicalization of abortion in the American context. Illegal abortion throughout the 20th century in the United States was dangerous. It was expensive. It was dangerous and expensive, but it was also routine. Many women sought abortion outside of the organized medical system, but it caused the illegal abortions caused a heavy toll on women's health. Illegal abortion in this part of the 20th century accounted for 1 in 5 pregnancy-related deaths in the United States. And Cook County Hospital in Chicago alone was treating around 4,000 women a year for the consequences of illegal abortion. In part, this heavy toll of morbidity and mortality motivated physicians to lobby for abortion to be decriminalized and legalized in the United States. And we saw a number of states begin to liberalize abortion laws in the 1960s. And of course, the Roe v. Wade decision in 1973 made abortion legal throughout the United States. Three things I want to note about Roe v. Wade. Since Roe v. Wade was passed, we saw an increase and then a sharp decline in the incidence of abortion in the United States. It continues to decline. We also saw a dramatic reduction in the morbidity and mortality associated with abortion. And I'm also going to, a little bit later, point out the ways in which almost as soon as Roe v. Wade was decided, we saw a movement to restrict abortion rights in the United States. So we often think of Dobbs as, many people think of Dobbs as like, whoa, where did that come from? We had Roe for almost 50 years. In fact, from the time Roe was decided, the United States has been on a path towards retrenchment. Now, the United States, in liberalizing abortion laws in the 20th century, followed a similar pattern across the globe. In fact, most countries in the world had legally restricted abortion by the late 19th century. And the 20th century has seen a global pattern of liberalization of abortion laws. The Soviet Union was the first country to liberalize abortion law in 1920. And by the end of the 20th century, most countries in the world at least legally permitted abortion to save the life of the pregnant person. By the end of the 20th century, about 2/3 of developed countries permitted abortion upon request. That's the most liberal form of abortion legalization. But only 14% of developed countries follow that pattern. So since 1973, the United States has actually moved, as I said, in the opposite direction, with a long history of Supreme Court jurisprudence with state legislative efforts that have relentlessly restricted access to abortion over that time period, culminating in the Dobbs decision in June of this year. So I just wanted to give you some sense of the kinds of restrictions around abortion that existed before Dobbs. These are all pre-Dobbs restrictions on abortion. I'm not even showing you what's happened to legal access to abortion since Dobbs. Even before Dobbs, it was estimated that about 6 in 10 women of reproductive age in the United States lived in states that were hostile to abortion rights. And of course, access to abortion has only further constricted since the Dobbs decision in June. And I'll give you some pictures that show what the post-Roe landscape looks like. You can see, I think, the pattern that we will settle into is widely available, legally accessible, and safe abortion on the West Coast and on the sort of mid-Atlantic up through New England on the East Coast, and everywhere else in the middle of the country we'll see a lot of, we already have seen a lot of restrictions on abortion access, and we'll continue to see more. Okay. So one thing I want to stress about and we've already begun to see the number of abortions, particularly in states that restrict access to abortion, declining, although we're also seeing declines overall. There's clear evidence that women who might otherwise seek abortion care are not able to access it even today. So I'll just show you some pictures that show where people are having abortions is shifting. So there is a lot of evidence that women are traveling outside of their home states to access abortion care. And there's also a lot of evidence that some women who might otherwise seek care are not able to find it. I'll give you some examples here, and I'll talk a little bit more about this impact. So what I want to do in the last 5 minutes is talk about how the retrenchment in the United States looks different than what we're seeing globally. So in global comparative perspective, when countries have changed their abortion laws over the last 25 years, they've moved in the direction of liberalization. Deborah talked about the green wave in Latin America. 3 large countries in Latin America, Colombia, Mexico, and Argentina, recently legalized or decriminalized abortion. Chile has a draft constitution enshrining a right to abortion in that constitution. That's not yet passed, but that's in the draft. And many other countries around the world are expanding the grounds for access to abortion, even deeply conservative and patriarchal countries. So for example, Burkina Faso, Chad, Guinea, Mali, and Niger have all recently made abortion legal in the cases of rape, incest, and fetal impairment. So still greatly restricted, but moving in the direction of greater access. In fact, over the last 25 years, only 4 countries have removed legal protections for abortion. The trend has overwhelmingly been towards increasing access to abortion. These 4 countries are El Salvador, Nicaragua, Poland, and the United States. Since 1994, over 50 countries have liberalized their abortion laws. Okay, and I'll just show you a graph there of kind of how countries have moved around this. In the last couple of minutes I want to offer some reflections on how we might think about these different patterns and paradoxes we see around abortion. One thing I want to point out is that laws regulating abortion do not make legal or public health sense. Laws regulating abortion do not necessarily eliminate abortion, they make it less safe. And in fact, various studies have shown that the more restrictive a country's laws are, the more the law is flouted within and across borders. What makes abortion safe is simple and irrefutable: when it's available at the request of the pregnant person and when it's universally affordable and accessible. The second reflection I want to offer is that history is not linear. Progress and regress coexist. So we see these historical patterns and precedents that might sometimes surprise us. The United States previously was a liberal state that was a global leader in legalizing abortion nationally in terms of Roe v. Wade. But as I said, the retrenchment from the moment that Roe was decided has been relentless. And we could go through the sort of long history of state laws and Supreme Court decisions that culminated in Dobbs. Activism matters. Deborah mentioned the green wave in Latin America. Until very recently, 97% of women in Latin America lived in countries where abortion was outlawed or severely restricted. That is changing very rapidly. And we've seen other cases of surprises. Ireland's constitutional referendum in 2018 liberalized abortion law. That referendum passed by 66%, a surprisingly large margin in a country that was previously considered a highly Catholic country. But speaking of Ireland, I want to come to one of my final lessons or takeaways here, which is that abortion rights are not equivalent to access. And in fact, rights without access are meaningless. So Ireland, to the sort of delight and surprise of the world, liberalized their abortion law in 2018. However, today, in 2022, most Irish women continue to go to England for abortion care. There's a lack of doctors to provide abortion care in Ireland. There's resistance, in fact, among the medical profession to providing abortion care. And there's a profound absence of infrastructure. So kind of changing the law and making abortion legal did not sort of make the infrastructure to support abortion care magically appear. In other parts of the developing world, severe underinvestment in healthcare infrastructure and dearth of healthcare providers in general mean that women cannot access abortion care even when it's legal. So Zambia, where abortion is legal, has 1 in 3 maternal mortality deaths in Zambia are due to illegal, unsafe abortion because women just don't have access to safe abortion care. And in many countries of the world, including in the US, national leaders utilize heavily moralized language to shame, blame, and stigmatize women who need abortion care. The United States is a good example of this in many registers. Another example would be Turkey, where abortion is legal, but Erdogan has for the last decade framed abortion in heavily moralized terms. He explicitly talks about abortion as murder. So rhetoric about abortion, along with unclear interpretation of conflicting and confusing regulations around the circumstances under which women are legally able to access abortion, often translates into medical reluctance to provide abortion care. So I'll just end with, and we're seeing increasing reports of this chilling effect in the United States, with providers hesitant to provide not only therapeutic abortion or abortion care, but also to provide certain kinds of medical care for women suffering miscarriages. And the ambiguity around kind of what constitutes a risk or a threat to the woman's health or life is a big problem here for the medical profession. As one Austrian doctor put it so powerfully, there's only one way to be sure a woman's life is at risk, that is, after she dies. So I'll just end by reminding everyone that the availability of safe abortion depends not only on permissive legislation, but also on permissive environments, on political support, and on the ability and willingness of healthcare providers and services to provide care for women. Treating abortion as an essential healthcare and as a moral and human right is the only route to providing access to abortion.
I'm glad to start this talk by thinking about rights and justice, access and development. So these are the terms that I want us to think about as I reflect on what do we mean by reproductive justice in settings in the global South. And I'm definitely not the first one who's been thinking about reproductive justice. It has been a term that has been conceived by feminists of color to offer a broader view than just reproductive freedom. So reproductive justice is not just, oh God. Why is this going on? Didn't even touch the slide. Maybe I don't full screen it. Does that work? Lots of scholars have been thinking about reproductive justice and and the reason why we are thinking about reproductive justice is because it's not just about access or rights. As Betsy pointed out, like once you have rights, it doesn't mean that those rights would actually translate into effective outcomes or access. So it's not just about choice or rights, but really about access. And scholars have defined reproductive rights more expansively to include right to not have children, as well as the right to have children and the right to parent with dignity. So using a more expansive way of thinking about reproductive justice to include access to abortion, contraception, adequate prenatal and pregnancy care. And what I want to focus on today is the right to have or not have children. And the reason I want to focus on this is that many women in developing countries actually cannot decide whether they want to have children or not have children, how many children they want to have, and exactly when they want to have them. So both the timing, number of children. So there's a big mismatch between women's perceived ideal number of children and the ability to achieve. I just feel like not using slides anymore. Okay. So why do women do not have a right to decide? And one of the reasons goes back to gender norms and when we think about patriarchality and the patriarchal bargain. And the reason I put this slide up, so I do my research on India, and this is a very popular series. It has featured on Netflix. I don't know if some of you have watched it. It's called Indian Matchmaking. And what was very striking to me about this event and about this particular episode in the series is that this is the first time I saw a mother-in-law enforcing her right to decide when her daughter-in-law should have the child. So she's controlling fertility of both her. She has 2 sons. She's controlling the fertility of both the elder son and the younger son. So she decides when the elder daughter-in-law would have the son. So in most in settings, like India, this is what we see where you have patriarchality, and often parents-in-law and family-in-law enforce or decide how many children and when a woman will have a child. And this is not something which is specific to India. And there's research which shows us how women's lack of extra household connections extra household connections can really restrict women to households and limit their fertility decisions. So what happens is that women's fertility decisions are really not theirs. We see that 1 in 4 rural women in Côte d'Ivoire also experience lifetime abuse, which is linked with reproductive control that is perpetuated within families. And when we look at low and middle income countries more broadly, low autonomy in the household, low autonomy in the household decision making, and acceptance of intimate partner violence has been found to increase the likelihood that you would have more than. So at the same time, when women cannot decide when to have children, they also cannot control the number of children they will have. And it's intimately linked with gender norms, both within the family and in the society. And why is it really important that women have full control over their fertility decision? And it's not a trick question. The reason why it is important that women have full control is not just a matter of rights or freedoms, but the right to have or not have children is relatively more of a life or death question in countries in the global south, and it's also a development issue. So it's problematic for more reasons than we often think about decision and choice. And what I want to do is just give you some facts about maternal mortality in the few slides, and what it really means to not have the right to decide how many children to have and when to have them. And when we think about maternal mortality, so we see that about 800 women die each day from complications in pregnancy and childbirth. 99% of these maternal deaths occur in developing countries. And as a result of the norms that we saw earlier, so control over women's autonomy, not only do women have the right not to decide, but they have less information about, or they are unable to learn about these risks. So at the moment you cannot decide, you face this risk of life and death. At the same time, you don't have information about how much of a risk this really is. And traditions and pervasive beliefs actually impede this learning. So you have it in all 3 ways. So you don't decide, you risk to die, and you risk not knowing what you are setting yourself up for. So what does maternity mortality really mean? It refers to deaths due to complications from pregnancy or childbirth. And the optimistic side of the story is that from 2000 to 2017, the global maternal mortality ratio has declined by 38%. So what we are seeing is that increasingly we are getting better at having safer births, and fewer women are dying, have died as a result in the last 2 decades. However, this experience over time is also not uniform. And what we see is there are only few countries in the world where a young woman today is more likely to die in childbirth than her mother. And those few countries are United States, South Africa, Suriname, Guyana, Zimbabwe. So there are very few countries where there has been a decline, not only in rights, but also in terms of healthcare and infrastructure, where you see that women have lesser of a likelihood to survive during childbirth. When we think about this spatially across the world, two regions alone account for most of the maternal mortality, and these are Sub-Saharan Africa and South Asia. So 68% of all maternal deaths take place in Sub-Saharan Africa and 19% in South Asia, as you can see on this graph. And however, it's, as the previous graph also showed you, there are also places in the world where it's extremely safe to be a mother. And most of them are in European Union, where the maternal mortality ratio is low, and there are only 8 maternal deaths per 100,000 live births. And in some countries like Poland, Greece, Finland, and Sweden, the rate is even lower. On the other extreme are countries like Sierra Leone, where 6% of all young women, 15-year-old women, will die of maternal causes in the future at the current rate of maternal mortality. And in some countries like DRC, Chad, Nigeria, Niger, and Somalia, it's about 4%. So that's about every 20th woman dying of childbirth. In India, the ratio is lower, so it's somehow lower. It's somewhat lower than Sierra Leone, but it's still very high, and that's 145 per 100,000 live births. So maternal mortality ratio only captures the risk of death for a single childbirth. But because in most countries in the global south, many women will experience fertility more than once, the lifetime risk for maternal death is higher. So the lifetime risk of maternal death is the probability that a 15-year-old girl will die from complications over her lifetime. Here again, we have made progress, and the rate has nearly halved. So over the last 20 decades, it has become increasingly safe for women to have multiple pregnancies and survive. The lifetime risk of maternal death, again, is extremely low in high-income countries, so 1 in 5,400, as compared to 1 in 45 in low-income countries. And that is, this figure of 1 in 45 is something to really, remember and settle in while we think about it. Why am I showing you these numbers, or I'm discussing these numbers, is because these are entirely preventable deaths. So all these figures that you have just been exposed to, these are deaths that could have been avoided. So one ways of thinking about this is that we see that in high-income countries, very few women die during childbirth. So just by that logic, we should not expect women to die in countries that are poorer. And another way of thinking about this is, what would happen if we all got to EU? So if all the regions achieve the living standards and healthcare of the European Union, almost 95% of these deaths and the numbers that we saw would be avoided. So that is 300,000 mothers saved each year. And going back to what Betsy said, unsafe abortion is also one of the causes for these deaths. So what can work and what has worked in trying to prevent these deaths, especially in the setting which remain underdeveloped, so India and Sub-Saharan Africa. And we can think of all different types of solutions: a medical solution, development solutions, and academic solutions. And what I really want us to focus on are development solutions and what we can do to prevent these, to make healthcare more accessible to women in poorer countries. And here I'm thinking about some development lessons from India and the role of the meso level. So, Betsy gave us this really nice scheme of thinking about reproductive justice on a scalar. So the micro level, the meso level, and the macro. And what can we do at the meso level to prevent these deaths? And here, the role of women's grassroots political leadership is really one broad-based political solution that can move the dial on some numbers. And the reason I bring this up is, while we have 19% of these maternal deaths in India, there are also more women at this meso level who are grassroots political leaders in India. So almost 63% of all local leaders in the world are Indian women. So that's the scale at which we have grassroots women's political power in India. And this grassroots political leadership in societies in developing countries where bureaucracy and state is often politically mediated, where you need connections and networks with politicians to access safe healthcare, can play a role when women occupy these grassroots political positions. And what I see in my research is that women not only themselves directly mediate with the state to enable women to access these healthcare services, but are also utilizing activists who operate in the meso level, bringing them into the political fold, making them effective claim makers and political brokers in these settings, where political connections matter to get things done. And what I want to show you are these active women who are present in political parties, and they do all kinds of political organizing and political participation. But behind the scenes, what they also do is they enable access to public health care. And what you see is, some quotes from interviews that I've had with women activists is how they stand together with women, take them to hospitals, and negotiate access with government bureaucrats, and see these women through those pregnancies. So this is the meso level, at which grassroots political leadership can be extremely important if it has descriptive representation. Women also implement other policy solutions like self-help groups, which increase women's extra household connections. So how do we shift women's norms from within the family and empower them to have connections outside the family? So these solutions, also rely on these grassroots leaders to get implemented. Again, connecting with grassroots health workers. So most grassroots health workers in developing countries, including India, are women. And however, they often lack the requisite connections and the infrastructure to enable women to access nutrition or the right medicines. And this is where, again, grassroots political leadership at the meso level is so powerful. So in conclusion, I just want for us to think that in addition to rights and access, when we think about reproductive justice, and we think about this in a setting of global north, we also have to think about this in a development work. So beyond rights and access, essentially thinking about what's the development side of reproductive justice. And there's a huge gap between rights and access for other reasons, like lack of public service delivery and policy failure, which remains uneven and weak. And here, grassroots politics can shape both policy success and failure.
Okay, I'm glad that worked. I was very nervous about what was about to happen when I tried. Well, thank you everyone for being here, for the organizers. So I'm going to be switching focus towards both up, like putting the focus up on a macro level, and also switching focus with talking more about LGBT plus rights within the global community. So with that, I'll be going over sort of what I'm calling this like global story in 3 acts. I'm basically going to give an understanding of where the state of play when it comes to LGBT plus equality around the world kind of lies at this historical moment. So the first act is the backdrop. So I first want to start off by giving a general overview of how regulations and acceptance of LGBTQ people has been transformed over the last 30 years or so. So this first figure, that's why I'm really glad also the presentation worked out, because I'm very like figure heavy person. So this would be a total disaster if there wasn't slides. So the first figure maps the trajectory of various LGBT plus related policies over the last 30 years or so. And so this is where you can often you'll see popular discourse and narratives about how we've entered sort of this new, post-gay or this gay revolution moment, and we're seeing this expansion of rights. So whether looking at employment discrimination bans or third gender marker changes or marriage equality, there has been expansion over the last 30 years, which is like a remarkable accomplishment. So it is social progress in some extent. Although, as we've learned, whether this translates on the ground is another question, but at least on the legal side, we have seen this expansion. Similarly, this also has been increasing social acceptance in terms of public attitudes. So this is a figure from Andrew Flores, and what it shows is basically, every observation is basically countries, but what it shows is that a plurality of countries fall within this third sector, which is that since 1980, a plurality of countries has seen social acceptance expand. So it's important to just kind of recognize that this is where sort of the optimism around being this new LGBTQ moment really comes from. We do see both legal and social acceptance increasing around the world. However, while it's nice to highlight this sort of this positive element, there is a concerning trend that has also been taking place at the same time that often gets less attention, especially within media, and that is a story of stagnation and decline. So the last 10 years, in every set of these three countries, attitudes have either regressed or plateaued. Though we largely, I mean, although some countries have improved, that's not the macro trend. The macro trend is that social acceptance has stalled out or gotten worse. Simultaneously, as well as in addition to the expansion of progressive policies of the last 30 years, there's also been new forms of legal repression as well being enacted. So, for example, more countries have the red line is recodifications of one man, one woman definitions of marriage, which has taken place either through constitutional amendment or legal or new laws like DOMA. And actually, more countries have recodified one man, one woman definitions of marriage than have legalized gay marriage. So more countries have actually hardened against marriage equality. And then the blue line or / green teal line are propaganda and morality laws. So these are laws that criminalize LGBTQ content from the public space. So if we were to continue this trend line, for example, Florida's Don't Say Gay bill is part of this trend line. Russia just this week enacted another propaganda law that further criminalizes speech within the public sphere. And propaganda laws are particularly nefarious piece of legislation because a lot of research demonstrates that visibility is an important mechanism through which social transformation can occur, whether that be in a policy route or a social acceptance route. And so by closing off visibility, which is what these propaganda laws are doing, it's closing off an important mechanism through which social change that we've seen over the last 30 years has been operating. And on a more individual level, for queer youth or people trying to explore their identities or sense of self, if that content is removed from the public space, then it also creates more question like, do I belong within this community or not? So now Act 2 is sort of the explanation. So why is this happening? In particular, I'm going to be focusing on like the expansion of repressive policies and the lower social attitudes part of the equation. And so there's a lot of reasons for this, but because it's only 15 minutes, I'm just going to focus on one key factor, and that's the rise of anti-LGBT plus INGOs. So international organizations, transnational advocacy networks are known to be very, very important to expanding rights around the world. And we typically have studied this within the academy. Basically, how do they expand liberal laws? For example, how do women's organizations, women's transnational advocacy networks expand abortion, environmental organizations expand environmental protections, and so forth. But here, what I want to highlight is actually the world is populated with more international organizations working against these endeavors than there are in favor of them. So this figure is the difference between anti-LGBT plus INGOs and pro-LGBT plus INGOs since 1900. You can see the scale is overwhelming, that anti-LGBT plus organizations overwhelm the international system. And the fact that these pro-LGBTQ organizations have been able to have an impact is pretty remarkable, considering that the scale of the opposition that they're working against. But more important than the number of organizations is their coordination and the relationships between these organizations, what I argue. So this is a figure that is basically how all of these organizations within this chart are related to one another by going to similar conferences or going to the same lobbying events within the UN. So it's like the relational structure within these networks. And so one thing I just want to highlight is just sort of the different elements of this network and their ability to make inroads around the world to undermine LGBT plus rights, but gender justice more broadly. And so one of the key arenas bringing these organizations together is this entity called the World Congress of Families. The World Congress of Families was founded in 1995 and had their first meeting in 1997. And the goal is to bring pro-natural family advocates from around the world together. And so since being founded in 1997, it has grown into this massive network system today. And so this is largely like a network of networks, and I'll kind of explain that as I go through, but just to get an understanding of why they've been so successful in recent years. So one element of this is an intentional focus on the UN. So this cluster over here, it's more just showing where they are on their map. It doesn't really necessarily matter where they are in the network. But the Civil Society for the Family is a group within the United Nations that seeks to affirm natural family norms within the UN system and simultaneously take out any language from reports, resolutions, et cetera, that could be read as promoting reproductive justice, sexual rights, gender rights more broadly. Another key element within this network, as we've been discussing, is fertility rates in abortion is a very big concern these organizations are focused on. And so the Population Research Institute is a network of demographers from over 100 countries that use life tables and population statistics and fertility rates to argue why we should not allow gender and sexual norms from being advanced, because they would argue that this is a threat to the nation through the very reproduction of the nation. And so demographers are especially important, actually, because this large system was founded by demographers, because it also allows academics and a scientized discourse to secularize their argumentation for when they try to go advance these claims within like the UN or government institutions that are more secular in nature. Another key focus is on legal mobilization. So for example, Alliance Defending Freedom, they were just at the Supreme Court this week in the 303 creative case, which is trying to get religious freedom or religious exemptions to the non-discrimination laws. So Alliance Defending Freedom does similar type of legal mobilization around the world. So there's how we saw within the US Supreme Court of trying to get conservative justices onto the high court to overturn Dobbs, or to overturn Roe v. Wade through Dobbs. These similar type of legal mobilization strategies are being done around the world. Hungary is another key example of where Alliance Defending Freedom has been operating. There's other groups like this, for example, called Advocates International. There's the American Center for Law and Justice, which also, all of these have multiple legal offices around the world and engage in this legal mobilization strategy. Additionally, another core element within this broader network is referred to as a political network for values. This is an arena of parliamentarians who come in. So natural family parliamentarians come together to share model legislation, talk about different campaign strategies in order to undermine LGBT plus rights, but gender justice itself more broadly. And then one last component of the network I just wanted to highlight is, so Citizen Go is this organization based in Spain, but it's representative of one core element is focused on social media campaigns and basically trying to infuse public discourse and with this messaging. And so this can be through, as I mentioned, social media campaigns, but then, for example, like Christian Broadcasting Network is really influential in funding like Christian content around the world. They also a number of other cultural organizations that focus on radio stations, particularly within sub-Saharan Africa. There's also various like book publishers that are also part of this like media content generation in order to get the masses to expose and socialize kind of into this perception or this perspective that they carry with them about the supremacy of the natural family. And so that was a lot of information, but one thing I just want to highlight within this is basically this network has been growing since the 1990s. So since the 1990s, which this was created as a reaction to both reproductive justice that was happening in the early 1990s and then women's rights happening in the early 1990s through the UN system. And so these actors came together and decided we cannot cede the global arena to pro-women's and at that time just pro-gay organizations. We instead must engage and adopt these same transnational tactics as well. But growing this takes a lot of money. So how is this infrastructure supported? So I have a paper right now that's about to go under review that basically demonstrates that post-marriage equality in the US, anti-LGBTQ organizations start funneling millions of more dollars abroad. So the US is the prime funder of a lot of this work that's taking place globally. And so one thing I really want to highlight with this piece are two things. One is that why I typically take a global transnational perspective on things is this demonstrates how marriage equality in the US directly caused anti-LGBT organizations to view that their money has more influence abroad and then start funneling money elsewhere that then can contribute to more regressive policy changes that are transpiring. And one thing I just want to notice is, so this is anti-LGBTQ foreign spending compared to just the general population of nonprofits in the US. And you can see, like, this dwarfs this considerably. Anti-LGBTQ organizations actually have a robust amount of money, and so they have enough money to both shift some abroad post-marriage equality, while still also having enough money to engage in these endeavors within the US as well. So the last part to wrap up is just the stakes. So basically, why should we care about this struggle, and what is like the larger sort of case that needs to be made about why we should care? So I would thank Nancy for pointing me again towards this quote. But basically, what a lot of proponents argue, or what a lot of opponents of gender justice and LGBT plus rights in particular argue, this is sort of like a civilizational divide. So this is a speech given by Vladimir Putin during the midst of the war in Ukraine. And he says, like, I want to address all the citizens of Russia. Do we want to have here in our country in Russia, parent number 1, number 2, number 3, instead of mom and dad? Have they gone mad out there? Do we really want perversions that lead to degradation and extinction? Do we, and then skipping to the end, we have a different future, our own future. So for a lot of these anti-LGBTQ organizers or activists like Vladimir Putin on the side of the equation, for them this is a civilizational, existential question about who are we as a people, and in particular, when it comes to like fertility, the very reproduction of the nation as well. And so as we are right now in this moment of democracy and autocracy, like threats to liberalism and rising illiberalism, questions of gender and sexuality are a core function of how these debates are playing out. And the other stake I just want to put out there is, this is a quote, this is more like, it's like at the personal level, or just like the material, like the subjective level rather, but this is a question posed by Judith Butler in their 2004 book, and it says, if I'm a certain gender, will I still be regarded as part of the human? And I argue you could replace gender with sexuality, but the broader point here is that we've created this category of human over the course of the human rights construction. And what a lot of these actors are trying to do is to strip away women and queer people from the category of human that comes with basic moral and social worth, and that is what this larger struggle and that is about, and the stakes that's what's at stake within this debate. And then, unfortunately, in a moment of rising religious nationalism around the world, in which to be a particular member of a nation state is often to discriminate against women and queer people around the world, this is now resulting in backlash policies that I've mentioned taking place. And so often, anti-LGBT plus actors are successful in arguing that gender and sexuality violate the natural family, which violates the nation, which violates God as well. And so, in this talk, basically, we want to show Act 1, we've seen an expansion of rights and repression. Act 2, there's this global network that is being part of it. In Act 3, the broader question I think is important for us to understand is, who gets to be part of our collective belonging? If anti-LGBT actors are trying to argue that the family, the nation, and religion are sites of heteronormativity, that procreation is the only purpose of sex, for those who engage in other types of sex or have other genders and identity and sexual identities beyond heteronormativity, do they belong within this collection, of any of these collections? Or do we have to reimagine what collective belonging does look like in order to make space for women and queer people? And that's the question I'll end on, and with that, I'd like to thank you all.
To you, Elizabeth, since you spoke about Ireland as well, 2 quick points. One is that I think connecting your talk to the other one as well, in interpreting the change in Ireland, we really need to take into account about the international and regional perspective that is in the title of peers, because you cannot make sense of what happened in Ireland if you don't think about the European Union, the European Convention, and in terms, and I think that's an interesting aspect, how in fact, when we look at the nation, we need to place them in this bigger boxes of international organization. And then, I suppose, again, it's more of a comment than a question, but if you look at the past of Ireland, that's the future of the United States, where in fact, I mean, there was a ban in Ireland, but you could opt out of the ban by simply traveling to England or to the Netherlands. And that's what's going to happen in this country now, with, of course, the consequence that you just have discrimination between women based on their wealth, if you can buy out of the ban or by traveling elsewhere or not. And there are so many legal questions that are now coming up in this country, which Ireland had to deal with. What free speech do you have about abortion access in England? Can you provide services overseas? Can you be prosecuted for traveling into England or the Netherlands? So just to say that actually comparative issues provide so many insights on this. But again, sorry, it's more comments than.
This is, I guess, mostly for Professor Armstrong, but I'm curious to hear what everyone else thinks. What do you think is the role of intimidation in preventing access to abortion? Not just, the physical ability to get to a clinic or a provider, but the social repercussions or fear of retaliation?
That could be posed to everyone, and then Nancy, and then we'll send it back to the panel.
I have a question for actually all three panelists. So the global kind of right-wing anti-gender movement is very unified and essentially both targeting women's reproductive rights, but also the rights of queer people. I'm wondering are there solutions, or are there just cleavages that's too much on the more progressive side in that maybe just LGBTQ communities and advocates for women's rights are not as unified, or are there tension that could be navigated in order to counter the right? Yeah.
Thank you so much. By the way, this is the Nancy whose quote was on the slide. Why don't we go down the table a couple minutes?
Sure, yeah. I think that point about the past of Ireland as the future of the US is really very striking. The one thing that I would point out that's different is Ireland is a much smaller country, and it's much easier to leave Ireland and go elsewhere. The United States is a huge country. And in fact, we already see an impact of the restriction of abortion in states where it's prohibited, spilling over into states where abortion is still legal. So here in New Jersey, abortion services have gone up by about 25% in the last 5 months. Women are traveling to New Jersey from Texas, Louisiana, Mississippi, all the states that you would expect. But women are also traveling to New Jersey from New York State, where abortion is legally available, to access abortion care, because they can't get abortions in New York because New York is absorbing so many women coming to receive abortions. So even where abortion remains legal and protected, women in the United States can't get timely appointments. So the abortion restrictions here, in part because of the size of this country, have the effect of making abortion less accessible everywhere, even where it continues to be legal. I think that's a really important distinction between the Ireland and England situation and the American situation. I think that your point about intimidation is a really important one. Abortion has been stigmatized and heavily moralized in the United States for decades. That definitely has an effect on women's kind of conceptual ability to imagine themselves as a person who has, who might access abortion care. And I think there are lots of examples of moralizing and stigmatizing behaviors having profound effects on people's ability to access services or to understand who they are as a person or to affect kind of their ability to move in the world. I'm sure Kristopher could speak to that as well. Nancy, solutions, and I'd be interested to hear what my panelists have to say about this as well. I mean, I think, you know, in the United States, we also have the paradoxical fact that, as best we can tell, about 60%, 2/3 of people in the United States support legal access to abortion in some form, and yet we're in this world where we don't have legal access to abortion. However, Kansas, we saw a huge response that has to be tied to Dobbs. Michigan just passed a state referendum enshrining the right to abortion in their state constitution. I think we are seeing an increase in political activism around abortion rights in particular in the United States. That's maybe some cause for hope. And there are these kind of patterns of reaction to big political
swings in access, I think.
Yeah, so I guess I'll touch on Nancy's question of sort of solutions. So one thing that while I focus on the global transnational level of anti-LGBTQ organizing, one of the reasons why they've been successful is they've actually taken a very, very regional, local approach. So I have this other paper that basically analyzes that basically anti-LGBTQ actors move in first, and then sometimes they'll get some sort of reaction policy, and then pro-LGBTQ organizations come in, and then it's easy for the state or people or opponents of LGBTQ rights to then be look, they're the foreigner who came in. They're part of the foreign, a foreign import. Even though it's a lot of U.S. evangelical money that finance the repressive policy in the first place, people don't necessarily make that connection of U.S. influence. But then once pro-LGBTQ organizations come in or the UN says something, then they'll point to it as clear evidence of you're the foreign actor within this equation. And so one thing that I actually think that the best solution is for pro-LGBTQ activists is to be as local as possible and to hide transnational connections as much as possible. From a democracy standpoint, it's actually pretty bad in terms of at least if the U.S. state, the State Department wanted to fund these groups to help them, they should actually do it in a way where no one can track the money. But from a democracy standpoint, it's really bad in the U.S. But from a activism standpoint, the association with the West and the international has been a very powerful argument. So I think a solution would actually be to minimize that to whatever extent possible. But also for women's organizations and queer organizations to view this as one, because their opponents view it as one issue. And I agree, we should view this as one. It's all about gender at the end of the day, and so we should fundamentally view this as one broader systemic fight.
Let me ask the panelists. We are at time, but also we were delayed by time. Can we take another round of questions or? Yeah. All right. You too. Actually, louder, please.
I have a question for Tanushree, and that was about in terms of the optimism regarding women leaders in furthering reproductive rights. Thinking about even the example that you had about the mother trying to control the fertility of her daughter-in-law, right? These leaders as women who also have contradictory positions regarding to rights. Does that also influence the way in which their interventions work, that we are not going to support you to mobilize for contraceptives, something like this? And also in terms of thinking about the bigger picture, where we have in India a right-wing government with a particular kind of agenda, you have local leaders, they're still connected to national party politics, and how does their political affiliation impact the way in which they work on the ground?
One last question.
Yeah, my question is for Professor Velasco. In regard to the U.S. funding and the politicizing of that, do you see possibility of taking a deeper look in these places, like in West Africa, for instance, the coloniality of gender, and then that critique where gender, heteropatriarchal relations, and biological dimorphism are products of the colonial system itself? Is there possibility there for education? I don't know.
Right, last round. You might want to repeat the question in a sentence. I'm not sure everybody could hear, and then we'll wrap up.
So I think you're touching a very important point, which is, amongst this optimism, where is the scope for pessimism? I think what you're highlighting is the scope for pessimism. So what these women are doing at the grassroots are enabling women to access healthcare, regardless of their political affiliations. It's because they depend on these women to turn out to vote or to participate in electoral or non-electoral politics. They're serving them to access healthcare because that's not a contentious issue. Want to access a government healthcare hospital, they enable them to access contraceptives or something that they want to hide. I think there, I would be less optimistic. but it also depends on women's solidarity, right? So when even women get together in groups, there is a different form of solidarity that emerges. I'm hesitant to say that I've seen that, but I think it is pushing towards that. So when you have women's groups, we can expect some solidarity, even on behaviors that are not widely accepted in the society. That's my one question. I think I'm going to just say that. For the abortion rights in the US, I think I'll leave that to policy. The fall back.
Sure. I think the question was partly why is maternal mortality higher in the United States today than it was 2 decades ago? And the United States is the only industrialized society that has observed an increase in maternal mortality over the last 2 decades. And it's really sort of the $64,000 question, why? There are a lot of hypotheses about why the US might be observing an increase in maternal mortality. We do know that about 2/3 of maternal mortality deaths in the United States today are preventable. So Tanu talked a little bit about preventable maternal mortality. I think another thing that's really important for people to recognize is that maternal mortality evokes the image of a woman dying literally while giving birth. In the United States today, half of all maternal mortality deaths take place postpartum, so after the woman has given birth. Only about 20% happen literally in childbirth. The rest happens before, in childbirth, and then after. And so there's many causes for maternal mortality. In the US today, one of the main causes of postpartum maternal mortality is related to mental health issues. So there's a lot of questions about access, the role of medicalization in shaping the context in which women give birth, how we don't necessarily provide adequate postpartum care for women. We tend to put much more postpartum care or much more attention on infants and newborns than we do on postpartum women. So it's a complicated picture, to be sure. And I guess one other thing I'll note about maternal mortality in the United States today is that, like many of our health indicators, there are huge racial disparities. So Black women are 3 to 4 times as likely to die from maternal mortality in the United States today as white women.
Yeah, and so then to your question about what's the role of basically kind of tying into pre-colonial histories as an organizing strategy, and that is precisely what is happening, for example, right now in Ghana. Ghana is debating what would, if passed, would be one of the most expansive anti-LGBTQ policies in the world. And it came about after a World Congress of Families event in 2018, was the inspiration for this policy. And so the organizations in Ghana right now, some of them are trying to make that exact argument, that the penal code, the gender norms that exist in Ghana right now are entirely result of colonization. And so are they going to be successful in that endeavor? I don't necessarily know, but you do see that being a strategy they're increasingly going towards, of how can we how can we demonstrate our localness while simultaneously the activists keep pointing out the connection between this bill and US evangelicals. That we've always been here in part of Ghanaian history. It's evangelical, Christian evangelicals and missionaries who are the Western import. And so they're trying to flip the script as much as they can. I don't know if they'll be successful. The speaker of Parliament said that he's determined to get the bill passed this cycle. So we'll see what happens. But that's what, at least on the ground, that's the angle they're taking.
By way of conclusion, before we clap for our panelists, I just want to say a few things. First of all, I thought this conversation was incredibly generative. There's so many more conversations that I hope follow in its wake. But if I could for a moment bounce back to some theoretical questions I think it leaves us with, and then end with the existential and then happy holidays part. which is I think that oftentimes in the social sciences, we are driven by more material institutional understandings of dynamics. We presume that the driving conflicts are redistributive, that the driving conflicts are material, and that's sort of the bread and butter of much of political science. And really what we've highlighted today is something that will be obvious to anthropologists and obvious to those who do cultural studies and the like, but how central these cultural issues can be, not only about what is the nation and what is the family and what is gender, but in ways that have serious existential questions. I think it's a real challenge to the social sciences to remember how central these sorts of cultural norms-based questions can be, not as on the side, but fundamental to those debates. Not a surprise to you, but a real challenge to the social sciences, I think, as a whole. Secondly, I'm struck by how often the term risk was used and how central that is as a political concept, not just a medical statistical one, that anything above a certain percentage is high risk or not, but the political challenges of thinking. Third, we've highlighted the importance of law and court rulings, but also how that's only the point of departure, key, formative, central to what we do, but obviously the question of access, affordability, norms, and practices remain an issue. Next point I want to highlight is that we oftentimes are in conversation with our own colleagues, but we're reminded today of how important it is to speak not only cross fields, but to put country-based knowledge in conversation with one another. We rarely have colleagues from focusing on the United States in the conversation. And again, we've highlighted how important it is to put that in comparative perspective. Final thing I want to note is that we have been reminded that nothing is linear. Any progress that we might see going forward, whatever your normative perspectives, is open to political debate. Really hard, really difficult, but we should never take the rights that we have for granted, because there are always people who are going to mobilize in one way or another. So with that, I want to say not only happy holidays to you all, and I hope that we see you in 2023 at the other events that we'll be holding on other issues, but I think we all want to give our panelists a warm applause and thank you.